Black women are often juggling their roles of being mothers, wives, partners, and sisters, which leaves them little time to tend to their health. However, we must work together to empower each other to make sure we have good health. Breast cancer is the most common cancer affecting women. White women are more likely to be diagnosed with breast cancer, but Black women are more likely to die from it. There are several reasons for this, one being that fewer Black women receive regular breast exams and mammograms, so their cancer is not caught early.
I had a very active lifestyle, and as a woman, I was always taking care of somebody. So I was busy in my church and activities at work and with my family. I was the only one that had breast cancer in my family at that time. So that's why I didn't even really worry about it, because nobody in my family had been diagnosed with it, but people have had other forms of cancer in my family.
I had a very active lifestyle prior to my diagnosis of breast cancer. I'm prior military. I was in the Army Reserves. I'm self-employed. I have my own CPA firm and very active in the community. I had never had a clinical breast exam or a mammogram until I noticed an irregularity in my breast. I was referred to the Center for Black Women's Wellness for my first ever breast exam and learned through the biopsy that I had breast cancer.
Breast cancer results when abnormal cells in the breast begin to grow uncontrollably. Breast cancer may spread to other areas of the body. Early detection and treatment can increase a woman's chance of saving her breast and surviving breast cancer.
The reasons I did not have regular breast exams in the past was because I was thinking I needed to wait to age 40. But even before that time, I discovered a lump was in my breast, and at that point I went to the doctor and was later advised to have a mammogram done. And when it came to that lump, it was benign.
I had clinical breast exams every year. I found that by doing it during the Christmas season, because I always took off work, I would have my women's wellness exam and my mammogram done every year at the same time, at the same place also.
Breast cancer runs in my family. My paternal grandmother actually died of breast cancer. My father was diagnosed with colon cancer about 10 years ago and he beat it. His two sisters were diagnosed with breast cancer and they both beat it.
There are a wide range of risk factors for breast cancer. Women develop breast cancer more often than men, but men can still be affected. Your risk for breast cancer increases with age, genetic, and family history. Women who have not had children or those who have children at a later age have a greater risk for breast cancer. Not breastfeeding has also been proven to show increased risk. In addition, women who begin having periods before age 12 or who went through menopause after age 55 are at a slightly increased risk for breast cancer. Being overweight, lack of physical activity, and high-fat diets are also major risk factors.
I was diagnosed with breast cancer, and that it was stage 1, and that we would start working with it right away. I was angry, I was scared. Basically, I was scared because I hadn't ever talked to anyone that had breast cancer. So I had always heard stories, but I'd never really talked to a person that had it. And I thought because there was nobody in my family that had it, I couldn't imagine that I had it.
When I found out that it was breast cancer, I was at stage 3. It made me feel very angry at first. I went through a period of thinking that I might not beat it because of my grandmother dying of breast cancer. But once I got past all of that and actually began to open up and share with family and friends who encouraged me that cancer is not a death sentence, then I was able to move forward and focus on beating it.
Changes to look for in the breast are a lump, which can be in or near the breast and underarm, thick or firm tissue, change in the size or shape, nipple discharge, which is fluid that is not breast milk, nipple changes, this is seen when the nipple points or faces inward, as well as any skin changes such as itching, redness, scaling, or dimples. Keep in mind you can also have breast changes during menstrual periods, pregnancy, while breastfeeding, as you approach menopause or during menopause.
I knew that this was something other than a normal change when over a period of months, as I was doing my own self-examination, that my breast became harder and harder, and there was a lump that started growing bigger and bigger.
To determine serious breast changes that may be a result of cancer, you should do the following: breast self-exam, clinical breast exam, mammogram. Breast self-exam is recommended on a monthly basis for all women to screen for changes in the breast. Women should know how their breasts normally look and feel and report any changes to their doctor or healthcare provider. It can be done in the shower, in front of the mirror, or laying down. There are 3 ways to do a breast self-exam. Move hand in circular motion while pressing down on the breast from the outside of breast towards the center. Move hand up and down while pressing down on the breast from one side of the breast to the other. Move hand from outer breast towards center, pressing down, covering entire breast. A clinical breast exam by a doctor or nurse should be a part of a regular health exam and should be done at least every 3 years for women in their 20s and 30s, and every year for women 40 and older. This can be a part of a woman's annual checkup. Mammograms allow your healthcare provider to have a closer look for changes in breast tissue that cannot be felt during a clinical breast exam. Women should have mammograms starting at age 40 and continue to do so every year for as long as they are in good health. Mammograms may need to start earlier if you have a family history of breast cancer. A mammogram takes an X-ray image of the breast tissue. If it is abnormal, you need diagnostic testing to determine if it is cancerous.
The Center for Black Women's Wellness referred me to a Medicaid program for women who have been diagnosed with breast or cervical cancer, because at the time I was just leaving my former employer and I decided not to pick up COBRA, and since I had the diagnosis, I wasn't able to get regular health insurance. I applied for the Medicaid for women with breast and cervical cancer and was actually able to participate in that program. And it took care of all of my treatments, the chemotherapy, the radiation, the mastectomy, and now even the reconstruction.
I would advise others who are thinking about getting a mammogram to go ahead and follow through, because mammograms can save lives, and early detection is very significant in a person's diagnosis if they are to come across something that they feel that's indifferent in their breast.
Well, from what I would say to a woman who was fearful for having a mammogram is that be afraid not to have one, because there's not always a lump like I had always heard. There's not always pain, because I had no signs of pain. So I would say be afraid not to have one.
Black women can continue to thrive within their families and communities as long as they are healthy. Regular preventative screenings, such as clinical breast exams and mammograms, and making small lifestyle changes, such as eating a more nutritious diet, reducing stress, and getting more active, are among the many ways women can take charge of their health. Make a decision today to strive for better health and better living.
I'm self-employed and I don't have insurance. Therefore, the Center for Black Women's Wellness has been beneficial in me maintaining my health with being able to give me excellent service as well as referrals to other clinics that give me that excellent service at a lower cost.
For me, life after cancer means freedom. I'm free from worry about whether I'm going to survive. And life after cancer has given me a new purpose to educate men and women about breast cancer, encouraging them to do regular self-breast examinations and getting their annual mammograms, especially if cancer runs in their family, to get it earlier than the recommended age, and to just be overall more aware of their health issues.
My description of life after cancer is I don't take life for granted anymore. And when I talk to women or get the opportunity to talk to women, I always encourage them to have that mammogram, to take care of yourself the way you take care of your family, the way you look out for your best girlfriend. But to definitely take care of yourself, get that mammogram done every year, get that woman's wellness exam done, that it plays a more important part of your life than you can think at that time.
For more information and low or no-cost services, please contact the Center for Black Women's Wellness at 404-688-9202 or go to www.cbww.org.